Hi, I'm Lisa. I am with the SHARE project here in Haywood County, and we've been doing a series of interviews on resources in the area, resources that are available to families as well as to those seeking treatment. And SHARE stands for spreading hope and awareness and removing the epidemic stigma. And each of these interviews, we've been trying to kind of touch on each one of those words: spreading hope, spreading awareness, and removing the stigma. Today's interview is a little bit different. We are definitely doing our part in bringing awareness to a resource that's in the area. We are talking about substance use disorder and addiction, so we are removing stigma. And we are definitely spreading hope, because one of the hurdles that there are oftentimes in someone seeking treatment is the financial aspect to it. Not only having the funds to get into the treatment centers or access, but even finding those resources or those treatment centers. So today's interview is going to talk a little bit more about that. I am with Amy Upham. She is with Eleanor Health Foundation, and this is what they do. They help plug people that are looking for resources in with those resources financially. That is oftentimes the biggest hurdle, is the financial aspect to it. So we're going to let Amy take it away. Tell us, please, a little bit about yourself to start with, how you got with Eleanor Health, what they do. We'll talk more about that for sure, but kind of what got you into this field to start with. So
yeah, that's a great question. And thanks for having me.
Yes.
So I started out almost 20 years ago now, if you can believe it, working with people with developmental disabilities.
Okay.
I worked in the self-advocacy movement, the nothing about me without me, person-centered, person first. And because of a family history of mental health struggles with my parents, they're both Vietnam vets.
Okay.
I really wanted to take that sensibility into the mental health world. And so a few years after I started in the behavioral health field, I did. I switched over to the mental health field, and I've kind of actually over the years switched back and forth. But of course, substance use has just come up again and again and again in that work. My heart has really been over the years with the homeless, and a good portion of folks who are homeless have substance use disorder. I personally haven't struggled with substance use disorder, but I have definitely had hard times and tough times, and financially and health-wise. So I know what it takes to struggle to really meet those resources and get what you need to get to cross that bridge. So yeah, a mix of sort of my work world and my family life, and then just sort of who I've encountered. It just seems like substance use disorder is such a hard thing to crack, and I don't mean the disorder itself for individuals, that's hard enough, but just the stigma and the access to resources.
Yes.
Yeah.
Yes, absolutely.
Yeah.
Finding those resources for sure. So a little bit of your work history. How long have you been in this area? Have you worked in any of the local treatment facilities, anything like that? Give me a little bit of that history.
Sure. So I moved down to Asheville about 8 years ago, up in Buffalo, New York, which is where I spent most of my adult life. Before that, I worked, again, mostly with people with developmental disabilities, a little bit in, actually I was, for a couple years, I was the anti-stigma coordinator at a mental health agency.
No kidding.
Mm-hmm.
That's cool.
We'll talk about that in a little bit. And then when I came down to Asheville, I was doing benefits counseling. I had been certified through Virginia Commonwealth University to sort of help people get back to work once they're, put on food stamps and Social Security and all of that. And it led me into, realizing that I wanted to do more for folks instead of just the one-on-one. I wanted to really make systems change. And so I got my master's in public health at Eleanor here, the graduate school in Asheville. And through that, I kind of fell into harm reduction work. I was studying the Hep C crisis, studying substance use disorder, and I realized I really, this was my passion, and I wanted to continue with that. So, I've worked for VIA Health in the area, Autism Society, and now with Eleanor Health Foundation. Oh, and the Buncombe County Health Department. So
Okay.
that was my last job.
Okay.
Yes,
Okay.
yes.
Very good. Yes. Okay, so how long has Eleanor Health Foundation been in existence, and what is it?
So Eleanor Health Foundation has been around for about a year as a nonprofit organization. It is separate from Eleanor Health Inc. So a lot of folks think that they're the same. We do not provide treatment, as you mentioned, or really any kind of recovery services per se. It was founded by some of the same minds that founded Eleanor Health. I think the impetus for the nonprofit was them recognizing, especially in North Carolina, that a lot of people did not have access to care. They were uninsured. Eleanor Health Inc. operates in 6 states, and I think North Carolina is the only one that has an expanded Medicaid. So there was a real need for treatment assistance, as well as social determinants of health, and so that's why it was founded. And here we are today, but there is definitely a firewall between the organizations, so much so that we don't only help people who are at Eleanor Health, we can help people engaged with any organization that's offering evidence-based care.
Okay, excellent. That was part of my question. We'll get back around to that a little bit.
Yeah.
Okay, so now you mentioned a term in there, social determinants of health.
Yes.
Okay, so expand on that a little bit, because if I'm correct, that is kind of a foundation of, kind of a starting point, would that be? Okay, so expand on that for sure.
Yeah, so our vision at Eleanor Health Foundation is equitable access to addiction recovery, prevention, treatment, harm reduction, and recovery services. And we feel a critical part of that is the social determinants of health, which is a fancy way of saying the things that people need to either engage with treatment and services or stay in them and maintain them. And there's a lot of research out there that shows things like housing, transportation, health insurance, employment, just whatever you can think of that are social determinants, even some of the isms like racism, ableism, homophobia, that those are all things that need to be addressed in a person's life. And it's not just about, medicating or stopping the substance.
Right, absolutely. Okay, so what does that social determinants of health look like then? Is that an assessment? Is that, okay, go ahead and expand on that then a little.
So we have a scholarship application online, and it's actually for all of our scholarships, so we can offer help with the social determinants of health or treatment and or recovery coaching, so that's like peer support services. Okay. And so somebody would apply, they would say, I need help with X, Y, and Z. If it's part of what we consider recovery capital, which are those things that increase a person's chance of engaging and maintaining in recovery, then if we have the funds and the person gives us back some of the paperwork, which is like, the release of information and some of those things, and we can get an invoice. That's the other thing we really need, obviously some proof that that's owed. We never give money to the individual. We always give it to an organization or whoever's providing that help. Then they're approved. We don't require that they have a urine drug screen for us to help them with that. Okay. We do want them to be engaged in some sort of recovery services. Part of that is we're limited in our staff capacity, so we do some care navigation, but we can't do all of it. So we want to make sure there's somebody in their team, somebody in their life that's helping them through that. So we do ask for a treatment confirmation letter, but it can be from a therapist, doesn't have to be from, like an OTP or an OBOT or anything like that.
Right. Yeah. Okay. So somebody then comes to you that's already kind of started their recovery process then,
or is interested in that, because a lot of times we'll get referrals from like peer support specialists, and like Sunrise, for example, locally in Asheville, they work with people on a harm reduction model. So not everybody that they're working with is engaged in treatment, but as long as they're engaged with that peer support specialist, research shows the likelihood of them, improving the quality of their life is pretty high.
Right.
So we're going to work with them as well.
Okay, so how does somebody find you then?
Well, we are actually I just registered us with findhelp.org, which is like a national, search site. Made it, clear that we're just really North Carolina right now. Hopefully as, we grow, then we can grow into other states as well. But also, I've sent out the information to all of the local providers. So all of the major treatment providers in the area has that information. We're going to be registering with NC Atlas, if you're familiar with that resource.
Shatterproof.
And NC Cares 360.
Yeah. Okay.
Shatterproof. Yep. I know that we're getting calls now. Like Buncombe County Drug Court just called us, and so we're starting to plug in and get referrals from different organizations.
Right. So can you tell me a little bit what that would look like, especially then, like Buncombe County Drug Court? Okay, so somebody's coming out of drug court and they have been told they have to go into a recovery facility or something like that. So tell me, kind of pick up from there what that would look like if you can.
Yeah, sure. So again, we don't we don't turn anybody away for still using drugs. So we don't ask, the drug court might have to collect some information, but we don't have to have that information, and we can accept referrals from other harm reduction organizations. But what it would look like is, either they want, today, for example, somebody wanted tools to go back to work because they're, they work with tools, and or trying to think of what other situations have arisen. So they make that application, we guide them through it, and then, we purchase the tools for them. Now, they also, if they want treatment, they can come to us for that too. So if the issue is they can't afford the treatment and they want, say, Suboxone on an outpatient basis, our treatment scholarships are all for outpatient. So we don't do inpatient. It's just too expensive. And research actually isn't that great on it, especially for opioid use disorder. But we work with anybody who has any kind of substance use disorder. I'm trying to think of, there was something else that was in my mind about that, but those are the basics. Oh, halfway houses. So that's a new thing that we've started doing.
Okay.
So we can do like an entry fee into a halfway house as well.
Okay. And they would have to already have in mind what halfway house, sober living home they would like to go to.
Yes. Again, we don't have the staff to do a lot of the care navigation. We can do some, and we do have a couple interns that work for us that help with that. But for the most part, we're going to rely on their treatment team or their peer support specialist to do that.
Okay. Okay, very good. That's good to know, because that part I was not clear on at all.
Yeah.
Okay, so they can find you. Of course, people refer them to you. Do you guys have a physical office that somebody walks into, or is it just mostly email, phone, those kinds of things?
We started during the pandemic, so we're
say no more.
Yeah. So we are definitely all online and virtually. We're also a small organization, so as time evolves, I think we'll want to get a dedicated space, at least part time. But right now, I work from home and do all that and travel quite a bit.
Yes.
Yeah.
Do you have then? Are you just among a referral network, or do you have a referral network as well? Then if somebody is. Does that kind of come in under the care navigation part?
Yeah, absolutely. So again, we're all throughout North Carolina, but most of our resources are for Western North Carolina, and that was because of a very generous grant from Dogwood Health Trust. And so because I've worked in Western North Carolina for so long, I worked at VIA, the health department, I actually over time have created a resource list for the Western region that I've given to our interns that they can help navigate. But we also use, the state has the Drug User Resource Guide, which is phenomenal, especially for medical services.
Okay.
So yeah, it's called the Drug User Resource Guide. So our interns use that as well. They utilize NC Atlas through Shatterproof if that person needs treatment. So we do actually do a good bit of care navigation. A lot of our recent referrals have been people who are either new or re-engaging in treatment and actually aren't connected with somebody yet. So we are starting to see a lot more of that.
Yeah, okay. Which is a big need, and that first step is, a big hurdle for people oftentimes. What about, can a parent come to you of an adult child, likely, and, kind of use you to find resources then, or is that something that they would just kind of look for elsewhere? If I was a mom, I am a mom. Yeah. But when I just found out my son's using drugs and I don't know where to go, but I knew about you, and can I reach out to you and you can plug me in with something, or is that not really something you do either?
We can. There's nothing to say we can't. One of the things that I'm working on some grants and hoping to expand that we have more staff, that we can have dedicated care navigators.
Yes.
And in that situation, then that would be definitely doable. Of course, working in substance use disorder, as a person who works in it or cares about it, I get those questions all the time. So it's not like a can't do. It's more like is that our main thing? No.
Yes. Yeah.
But Atlas is great for that, especially in North Carolina.
Yeah.
I would really. That's probably the first thing I would do is refer them to
Yeah.
Atlas.
Mm-hmm. Yeah. Find some, plug in all their
Yep.
parameters and see what comes out for sure.
Yeah.
I will link that Atlas in the description too, because that it's on our website, but that is great to know. So, let's see, how far is your reach? You know, you of course you're based in Henderson County, Buncombe County, but I know you are trying to expand into the further reaches of Western North Carolina. Am I right about that?
Yes, absolutely. So our grant from Dogwood covers all 18 counties that they cover in Western North Carolina. So that's from the eastern end of the western end of the state to the sort of Avery, McDowell, Rutherford line.
Yes.
But we do actually have a lot of applicants from the Raleigh area and the Winston-Salem area. Some of that is because of Eleanor Health Inc. when they heard about us, pretty quickly, and they start sending us people. So I'm looking for funding for those areas so that we can serve those applicants as well. But we have given a few scholarships out in those areas too.
Right.
Yeah.
Okay.
Yeah.
Okay. So anything else? Tell me. Anything else at all?
Well, one of the things that I think you all work on the stigma piece,
right?
And one of the things that comes to mind, especially because I was like the anti-stigma coordinator for a mental health agency, is when I was doing that work, what I learned and think about also with substance use disorder is that stigma is just another word for discrimination. And so I'll often use that word, but it looks like a lot of different things. And one thing that's really curious, whenever we give a presentation to people and share about Eleanor Health Foundation, I always ask at the beginning, what are a couple things that you would change for access to treatment and recovery? And the biggest thing, the one that has the most answers, is the actual services themselves. That they wish people wouldn't kick them out for return to use. Mm-hmm. They wish that there would be more diversity of services, cultural competency. They wish that, in other words, there is stigma within the system that we really have to root out. And so one of the things that Eleanor Health Foundation prioritizes and works on is research education, as well as some policy advocacy. We can't lobby for political candidates, but we can, discuss what different policies would look like. For example, one would be, a lot of substance use disorder doesn't have treat to target metrics a lot of the time. So what are the outcomes? Is this treatment working?
Is that what treat to target means?
Treat to target, yeah. So they call it, I think in North Carolina, values-based outcomes. Okay. And they're changing to that with Medicaid transformation. But yeah, there's not a national standard for that. Yeah. So we're behind those national standards, standards for halfway houses, regulations. So there's stigma everywhere and there's discrimination everywhere, but we're not afraid to talk about it within the system as well. We really want to encourage people to get the help they need. Yeah,
that's a shame that it's within the system.
It's everywhere.
It is.
It's just baked in, and it's not necessarily anybody's fault in particular. It's just how can we, and I think people sharing their stories. I love peer support specialists and working with them because they're so important to realizing that not only is recovery possible, it's very it's, what is that phrase, we do recover, it happens.
Mm-hmm. Yes. Yes, absolutely.
Yeah.
Yes, there is hope for recovery.
There is hope. Yeah.
Absolutely. Do you find then, talking about stigma, do you find stigma in your job? When you tell people what you do you feel as though you kind of have to explain? Or
yeah, it's interesting. Well, and so just like a little tidbit, even just doing our budget projections, I was researching other nonprofits that work with people with substance use disorder, and their donor base is really, really small compared to other nonprofits. So even just
Mhm.
getting financial support, you know,
I can see that being the case.
yeah, for mental health, substance use. Also, another interesting thing that happens is like when you work with people with substance use disorder, there's this assumption that, you know, you personally have gone through it, or and it's kind of like when I work with people with developmental disabilities, that was never an assumption that was made about me. But I had a sister who's autistic, or have a
Right.
sister
Mhm.
who's autistic, so that kind of feels a little bit like, you know, I don't know. There's like an identity that needs to happen. It's a stereotype, or you know, and so for me, I just see people as people. It just so happens that people with substance use disorder struggle significantly, and that's a population that I want to help. Yeah. So, yeah, probably could talk about it all day.
Yes, yes, absolutely.
Stigma's just everywhere.
Oh,
you
it
know?
just is. Yes.
Yeah.
It really is. And you know, I would like to think that maybe we're making some progress in the stigma area, you know, as far as, you know, I feel as though we talk about it more, you know, and not just because I'm doing this, but, you know, I feel as though
Yes.
that in some ways, and then, you know, then I see, you know, comments on different things. I know, oh man, we've got a long way to go. You know?
Yeah.
We haven't really made any progress at all.
Well, in Western North Carolina, I feel like there has been a lot of progress, you know, and it's in pockets and it's here and there, but I was really amazed to see when I worked at the Buncombe County Health Department, the changing culture. I think people the opioid use crisis got to a point where so many people were dying. We all had to just come together and just say,
Yeah.
You know what, we all know someone. It could
Yeah.
be me, it could be you, it could be your, you know, brother, sister. And let's just work together to, you know, to solve this.
Yeah.
So, yeah.
So how do you define your successes then in your job? What do you
That's a great
call
question.
a successful day? How do you define your successes?
That's a great question.
And what keeps you going?
Yeah. So, I think successes. So we have metrics. There's a scale called the Recovery Capital Scale that we use with everybody, and it's a way of measuring, you know, does this person feel like they have the supports to move forward? And so we do that, you know, at intake, and then 90 days after, we kind of give them the help. And that's been, you know, even in the beginning now, we're just been going with these scholarships for a few months, but you can see the difference that it's making for people. But, you know, a real successful day for me is, for example, one woman, she called and she uses her phone for treatment. She does virtual care, and her phone was going to be shut off. She accidentally, you know, kind of purchased a higher plan, thinking that, you know, it would be helpful, and then 2 months later, the bill was $400.
Ooh.
And she could not pay that, and that's obviously a need for a lot of different reasons, but treatment being one of them. And so we were able to, you know, after hours, you know, contact her carrier and get it paid, so that the next day, when it was supposed to draft from her bank account, it didn't draft, give her an overdraft fee, all of that, you know, and her just being like, thank you so much, you know. So it's those little wins for me that's like, successful day.
Absolutely.
Yeah. And policy-wise, you know, because we do work on policy. So, for example, before even I was at Eleanor Health Foundation, but now that I'm here, we're working with the Attorney General's office on ethics in patient care, trying to outlaw patient brokering.
Okay.
And
briefly explain that. I imagine there's a lot of people that don't know exactly what that is. I am a little bit familiar, but briefly explain that world, if you would.
Yeah.
Because it's,
Yeah. I think there's a movie out there now called Body Brokering, or Body Brokers, that I have yet to see, but I've heard it's really good. So it really, the case on this got cracked with Palm Beach, Florida. It's not necessarily where it started, but it's where it really kind of ramped up, that there were brokers or consultants that were being paid kickbacks for moving somebody from homelessness or a halfway house into a recovery center, residential, usually treatment center, and then back out and then back in. And from California to Florida, they'd send them up to New Jersey, New York, Asheville, North Carolina happens to be a hot spot because we're in the mountains, you know. equine therapy, all of that stuff. So usually they sell a very high bill of goods, but the way that they refer people is the troubling piece, because the broker themselves gets a kickback. So they started resorting to some pretty pernicious practices, like paying people to relapse, or giving them drugs to relapse, or paying somebody to get somebody else to relapse. And we actually have seen that with the homeless community and with sex workers. So it's kind of like it's a crime, like the mafia. It's a criminal enterprise, and it's happening regionally because there's so many treatment centers that are for private or for profit, and there's not that that's automatically a bad thing, but you see how many have cropped up in the past just 10 years. What I've heard from some people is that a lot of the folks that didn't get arrested in the Palm Beach sting moved up here, just like the halfbacks. There's halfback brokers. So anyway, I think the Senate passed a law against it, and it's now moved on to the House. Okay. So that's a win.
That's a good day for me. Yeah. So and maybe you can't answer this, but how would one vet then a treatment facility to make sure that is there a way to tell if there's a facility that seems to be participating in this?
Yes.
Okay.
There are some red flags for sure.
So what would those be?
If the main thing is, does it sound too good to be true? And so by virtue of having things like walks on the beach or equine therapy or wilderness therapy, that doesn't necessarily mean they're engaged in brokering. But, that should be a sign of, let's ask some more questions about this. So are they offering to pay for housing connected to the treatment but yet the housing is separate? Because if that's the case, then that's actually against insurance law. So they're not able to do that unless it's an inpatient facility. Are they offering airfare? That's against the law. Are they offering to pay for someone's health insurance? That's against the law. So anything are they offering cash incentive? That's obviously against the law. I'm trying to think of some other red flags. Those are the major ones. Yeah. And do they happen to, that's for a parent. Now for a provider, for us, for example, we've developed a halfway house policy, what halfway houses we will pay for. And one of the stipulations is we won't pay if the halfway house has a special relationship with a treatment center or a detox center, and it's sort of like the same people are going back and forth and back and forth. So that's a red flag. Families probably wouldn't see that, but if you work as a provider, you're going to start to see those things happen. Yeah. Okay. Yeah. Hopefully that's helpful. Good stuff. That was a little sidebar piece there. But that's very, very informative. So all right. Did we miss anything in the questions actually that you want to make sure that people know about Eleanor Health? I think that the other big thing in our vision again is equity. So that's a hugely important to us. Equitable access to care, and that looks like addressing racism. For example, there's a huge discrepancy between how many white people are accessing Suboxone and how many people of color are accessing Suboxone, and a lot of that has to do with where the treatment facility is located. Who has health insurance. What's the cultural messaging around it? If you look at, for example, the media images from the crack quote-unquote epidemic in the 1980s, it was all about criminalization. And then you look at the media images from the opioid use epidemic, and it's all about academic facts and figures and personal stories. So we do prioritize in our scholarship applications Black, Indigenous, people of color, and LGBTQ, also those who are homeless and who have co-occurring mental health. So we're really trying to get at those folks that are at the bottom of the heap. Yeah, the ones that do fall between the cracks. Yes, absolutely. So that's just one thing I want to hit on, but otherwise this is great. It's hopefully. All right, anything then that you talked about it a little bit, but that you would, since you've been in this world then for a good many years, if you could change one thing in the way treatment is accessed, stigma,
treatment facility, you know, what would that be if you had a magic wand and you could change one thing right now?
You know, it might sound kind of radical, but the one thing that I would change is, so with mental health in particular, and you know, addiction is a mental health disability. A lot of the time, what prevents people from accessing recovery is that they're singled out, that there's a pathology around it. Now, addiction is a disease, so I don't want to say it's not, but at the same time, what I see is that people who have resources are able to do things that don't get qualified as treatment or as recovery. Is just a part of life, right? So they can access yoga, they can access a spiritual mentor, a counselor, they can access exercise at the gym, they have access to things that we know keep people healthy. Exercise, you know, financial resources, food, nutrition. And so if I could change one thing, it would be to really highlight how much poverty is a part of this disease, that it's almost a social disease, right? So in America, and this is a public health term that's come up over the past few years, we have a phenomenon called deaths of despair happening.
Oh yeah, that's really increased in the past year with the pandemic.
With the pandemic, and it was going, you know, a few years before that, but for a few years before the pandemic, our life expectancy decreased for the first time since the Great Depression. And so, and you know, research shows it's because of our economic stagnation and our lack of health insurance, you know, medical insurance for many people. And so I think if we could address those things, I'm a macro thinker, a lot less people would struggle. And when they do struggle, they'd be able to get help a lot faster. You know, poverty is a killer. Yeah. And so that's what I would change is more focus on the social determinants of health.
Yeah. Good stuff.
Yeah.
Yes.
Thanks.
Yes, absolutely.
Yeah.
I could talk a little bit more.
I know.
We'll cut the camera and keep talking.
Well, it's been great to share with you. Thank you so much for having me.
Yes, absolutely. And then anything else then at all?
No.
All right. Well, thank you so much for giving us your time today.
Yeah. Thank you, Lisa.